This is called as augmented reality, which we all know about, and we are using it very routinely, like in an Apple device, something like a Vision Pro. Now it has an extension into joint replacement, and we have already completed the first 50 joint replacement using the augmented reality. So the future of surgical precision is here. As you can see me wearing the Pixee device. This is the usual thing which we wear. Now you all must have heard about robotic replacement surgeries. A future ahead of robotic replacement surgery is something called as augmented reality. Now, what is the main difference between a Pixee? Now, Pixee is a French company, and what Pixee actually means is a magic creator, which is a very small device. Now, if you see here, Pixee getting used, there are some barcode scanners which we need to scan. And once we scan it, the augmented reality actually shows us the mechanical axis of the knee. That is right from the center of the hip to the knee and the ankle. So it allows us, if you see the picture down, you'll be able to see that it is showing us a perfect precision with the smallest equipment available. And Pixee is something which I go to the operation theater with just one box. In this one box, I have this device which is the augmented reality. I just wear it this way and the surgery starts. Now when I use this, my camera here can see the center of the hip, center of the knee and center of the ankle as I am placing the knee inside the bone. Now, till now I am into joint replacement since the last 22 years now. I started in 2003. We have started with conventional jigs. Much before that we were doing freehand, considering the need to be approximate. Down 2 to 3 years down the line, we started using the standard jigs, which are almost accurate. And now going one stage ahead, we have started using the robotics. Beyond robotics is something which is called as augmented reality. In the picture down here, you can see a robot performing a knee replacement. If you just try to understand the foot size of that robot, the console occupies a big space in the theater. What it only means is, I can use a robot maybe in one hospital where I am installed. If one patient says that no doctor, I just cannot go to that hospital for so and so reason, I cannot move this robot to the next hospital because it's a big installation in the hospital. So the hospital should have a pre-installed robot. And the second problem of robot is, each company makes a robot, and that robot can make the joint of that company fit in best. So if we have a Wallis, it will fit a Johnson joint. Now, if a patient has a wish, no sir, I'm not very happy with Johnson, I would like you to do the Max. I have to say that no, I'm sorry, because I have the robo purchased. This is a big investment for the hospital and for the doctor, for the patient. So I have to push that patient to that particular hospital where that company's robo is. So what it actually means is that when I buy a particular robo, I'm married to that company for the next 10 years. I just cannot look around. Even if I find a very good joint available in the market, since my robo can take a precise cut for that company, I have to fit that only. Whereas when we are talking about augmented reality, this augmented reality is free. I can take it to any hospital, I can use it for any joint I want to do, and I can get a perfect precision. What in short it means is, this is a tool with the surgeon which he can use to improve precision. He can carry it to any rural center wherever he wants, to a major urban city. So augmented reality was first in ortho, but now it is coming into neurosurgery, it is coming into general surgery. There are a lot of softwares into this Vision Pro by which you can see intra-abdominal structures in a 3D dimension to have more precise surgical results. We all know that the first supercomputer was something like this. We all moved to a small computer which Steve Jobs gave us. That's an iPhone. The same thing is now happening into the surgical field. We came up with a big robo. Yes, definitely it is an instrument of precision. It comes with a huge cost, and that cost has to be shared with the patient. It comes with one company robo, like if I say Velis, I say Rosa, I say Smith & Nephew comes with another joint. So there are different companies coming with different robos, and these robos don't help a surgeon to take a cut. It does not help a surgeon to suture. It does not help a surgeon to cement the prosthesis inside. It only cuts the bone to give a proper shape. Like I would put it, if your joint has reached this stage, lights please. So, if your joint has reached this stage wherein there is a complete wear out of the cartilage, we need to cut it into a particular form where the cutting profile, only that company's implant can fit in. The same thing happens for the femur. We have a particular cut into which the implant is fitted. The cutting part of the bones is done by a robo designed for that company's implant only. So in short, if I want to tell you that this robo will continuously give footprints required for that joint only. So if you have come in our real reality from a supercomputer to a small phone, then why not augmented reality? So a new vision for orthopedic surgeons, augmented reality improves your accuracy, efficacy, leading to improved surgical outcome. So from a very bulky robo, which you can see here cutting the bone, to a Pixee which is now actually in this size. I go to any operation theater with a precision which is in my hands and operate the surgery. So that's the robo on your left, and that's the Pixee which I'm doing on the right. So that's a simplicity, that's a complexity. So this Pixee is completely in the hands of the surgeon, just like I have shown myself wearing a Pixee there just before the surgery. So it is as accurate as a robo. It is completely in the surgeon's control. It's extremely portable, so it's a very effective tool in a tier 2 and tier 3 cities. Like we have in Goa, fortunately, the Deen Dayal scheme, which government improved. So such schemes can be well incorporated with Pixee type devices, which are cost effective. When it goes to a robo, the cost of consumables are approximately around 50,000 and over and above the cost of the machine. So that does not make it a very cost effective solution for at least places like India and other developing countries. So very minimal footprint, and it is very well patient oriented. So you have, since the precision is good and accurate, you have a faster recovery, very low risk of complication because you can see the joint 360 degree when a human eye can see it in 2D. Augmented reality gives you a 3D print of the same. Improved surgical outcome. If the surgical outcome is good, most of my patients sitting here also, they have walked on the next day of surgery. They are comfortable going to the toilet, they are comfortable moving around, and in 3 days time they are comfortable to go home. That reduces your hospital stay, less of bleeding, nobody receives a blood transfusion now after a surgery, and better mobility. So augmented reality is the future of orthopedic care in India. As I rightly explained, in a developing country like India, expensive surgical robo in a 2 or 3 tier or a rural hospital is a big challenge. The cost of the robo has to be borne by the patient who is doing it. It goes from the patient's pocket finally, and Pixee, which which is a French company, has come to India by the Merrill. Merrill Medicals is basically a company in India. It is a Gujarat-based company, and they are first to import it in India for people, all of us to be used. So high cost of robot, and Pixee's the biggest advantage is the cost. Pixee bridges the gap between augmented reality and a robotic surgery, boosting patient confidence because the range of movement is excellent because of the precise fitting. From hesitation to healing, augmented reality brings happiness through precise surgery in urban center to rural center. That is what in India we should be looking at. Easy to adopt across multiple locations, so I can operate in any hospital with augmented reality with my system. And we have so many patients who are a testimonial for augmented reality. I thank you all for being here today. And how we do it. That's a spacesuit which I'm wearing. That's how we make the leg completely draped in a very sterile condition, maintaining a high level of sterility. That's the Pixee device. So as I'm seeing my vision can give me a 360-degree cover, a 3D model in front of me. So as I showed in the beginning, there is the barcode which I have to scan before. That's how the augmented reality confirms me that you are in the right place. That small device which gives us, that's exactly the box which I kept here. Thank you all for being here.